If you've just been told you have a positive CCP antibody, you might be wondering, do I have rheumatoid arthritis? Or what does this mean for my future health? Let's break it down together. Hello, this is Dr. Siddharth Amber from Chicago Arthritis and Regenerative Medicine. I specialize in non-surgical treatments for musculoskeletal conditions, rheumatology, regenerative medicine, and metabolic health. My goal is to help you live pain-free and optimize your health with cutting-edge treatments. Today, we're talking about a lab test that often brings a lot of fear and confusion, the CCP antibody. If you've tested positive for this, you might be concerned about rheumatoid arthritis. Today, we'll talk about what the CCP antibody is, what a positive result actually means, and how it fits into the bigger picture of diagnosing and managing inflammatory arthritis. The CCP antibody stands for cyclic citrullinated peptide antibody. It's an antibody your immune system makes that, when present, can indicate rheumatoid arthritis. It's not just a random finding. It's a marker that shows your immune system might be misfiring and mistakenly attacking your joints. Think of it like a smoke alarm. It's not the fire itself, but it can be a strong sign that something bigger might be brewing. Here's the key point. The CCP antibody is highly specific for rheumatoid arthritis. That means if you have a positive result, especially a high level, there's a very good chance that you either already have RA or could develop it in the future. It's more specific than the rheumatoid factor, another lab test often done alongside it. While the rheumatoid factor can be positive in other conditions or even in healthy people, a positive CCP is much more tightly linked to RA. Now, the CCP test is just one piece of the puzzle when it comes to diagnosing RA. Rheumatoid arthritis is a clinical diagnosis, meaning we need to look at the whole picture. Your history, for example, do you have joint pain, morning stiffness, and swelling in the joints? Your physical examination, are there signs of inflammation in the joints? Your labs, including the CCP antibody and others like the rheumatoid factor, sedimentation rate, and CRP test. Imaging, ultrasound or MRI to check for inflammation or joint damage. So it's not just a positive CCP that matters. That's not enough by itself, but it can be a strong early warning sign, especially if you've also started to develop symptoms. What if you're asymptomatic but CCP positive? It's an important one. Some people have a positive CCP antibody but no joint symptoms yet. That can feel scary. Here's what we know. People with a positive CCP and no symptoms may still go on to develop rheumatoid arthritis, often within a few years, but not always. In some cases, it may never progress. This is where close monitoring with your rheumatologist becomes essential. We watch for early symptoms, repeat labs, and use imaging like ultrasound to look for early joint changes and inflammation. Early treatment can dramatically change your long-term outcomes, so keeping a close eye in this kind of situation is important. In addition to the CCP antibody, you may have other labs checked. The rheumatoid factor, sedimentation rate, and CRP to look for general inflammation. The ANA test to rule out lupus if there's a concern for that. 14-3-3 ETA protein and the MCV antibody, the mutated citrullinated vimentin antibody, are also sometimes checked as well. Other antibodies and tests may be checked as well, depending on your story. For example, your thyroid tests, labs for sarcoidosis screening, or even multiple myeloma tests may sometimes be checked depending on your overall presentation. The goal here is to rule in rheumatoid arthritis and rule out other conditions that can mimic RA. So what should you do if you have a positive CCP? Step 1, do not panic. Step 2, see a rheumatologist. Let someone with expertise guide you through this. You may not need medication right away, especially if you don't have symptoms or signs of inflammation yet, but you do still need a plan. So if you're already showing early signs of joint pain or stiffness, early treatment is very key. Inflammatory arthritis can cause joint damage quickly, even within the first 6 months. Starting treatment early in this scenario can help preserve your joints and quality of life. So can you prevent RA from progressing? Maybe. If your immune system is just starting to misbehave, there are ways to try to reset or slow it down. For example, diet, an anti-inflammatory approach like a Mediterranean-style diet. Other lifestyle changes like regular activity, stress management, and adequate sleep. Supplements like omega-3s, turmeric, and vitamin D may help modulate the immune function as well. These aren't cures, but they may lower inflammation if it's mild and support your immune system. They're also very low-risk options, which fits with our general philosophy. Start with the lowest risk treatments first. So when should you start medication, however? If your symptoms are mild and your inflammation markers are low and your imaging findings show no significant inflammation, you may be able to watch and wait carefully. You do need to have a low threshold to start disease-modifying medication, however, if there's any signs of progressive disease or inflammation. And if your CCP is high and you're developing swelling, joint pain, or stiffness, you're likely in the early stages of RA. And that's when medication can be a game changer. Starting early can prevent joint damage and disability. You and your doctor will decide together based on your risk, your symptoms, and your preferences. Personalized care and shared decision-making. This is where it all comes together. Every person is different. Whether you're ready to start treatment or want to take a conservative path first, we will build a plan that works for you, respecting your goals, your lifestyle, and your concerns. So a positive CCP antibody test doesn't always mean you have active RA, but it does mean we need to take a closer look. Early detection and thoughtful treatment can make all the difference. Don't go it alone. There is a path forward. If you found this helpful, please make sure to like, subscribe, and check out our website at chicagoarthritis.com for more expert advice on staying pain-free and healthy. And if you're navigating a new diagnosis, we are here to help. Book a consultation anytime. Until next time, live well.